Hello, my name is Megan. I'm going to be a student nurse practitioner today. I'm going to be doing a cardiovascular examination. I'm going to first just describe the important landmarks for the cardiovascular exam before I bring my patient in. And at that time, I'll introduce her, I'll perform my hand hygiene, and we'll go from there. So first, the important landmarks is going to be your right hand side is going to be the aortic, and it's in the second intercostal space along the sternal border. This is the base of the heart where the S2 is heard. Then we're going to move across to the left. The pulmonic is the left second intercostal space along the sternal border, and the split S2 is heard here best, and the sound may vary with inspiration. Next is going to be the Erb's point, which is your third left intercostal space along the left sternal border. Then we're going to go to the fourth intercostal space on the left-hand side along the left sternal border. That's for the tricuspid, and a split S1 is heard here. Then the mitral is going to be the fifth intercostal space, the left mid-clavicular line. This is called the apex, and the S1 is best heard here. In the exam, the left lateral decubitus position, you'll hear the S3 and S4, and a mitral prolapse is best heard at that point. Lastly is the epigastric area, which is below the xiphoid process, and it's in the just left of the midline. This is where you'll feel palpations and if there's any heart hypertrophy. You'll also note that the mitral regurgitation, murmur, and aortic stenosis is best heard during systole. Next, we're going to move on to two tests that I'm going to not perform on a patient. I'm going to explain and walk you through that test. That's going to be the squat test and the Valsalva maneuver. The squat test, you're going to listen to the mitral area with the patient standing and then have the patient squat. If you hear a click resolve, then it may be due to a mitral prolapse. And then if you hear the click increase, it may be the opening snap of the aortic stenosis. For the Valsalva maneuver, you're going to lay your patient supine and listen to the mitral again. And as you lay the patient supine, you're going to place your hand on the abdomen and have them bear down as if they're having a bowel movement. If this click increases when the patient is bearing down, there may be a mitral valve prolapse. If the click resolves or decreases, then it may be aortic stenosis. Next, I'll bring in my patient and we're going to do the examination where I'll inspect, palpate, auscultate. Let me go grab my patient. All right, now I've got my patient here in the room. Hi, my name is Megan. I'm going to be your student nurse practitioner today. I'm going to be doing a cardiovascular examination. What is your name?
Autumn Stutz.
And what is your date of birth, Autumn?
10/28/11.
So since Autumn is a minor, we have parental consent to do the examination. Autumn, I'm going to have you lay down. I'm going to have you put your head right here. Bear with us. Our exam table is not very tall and does not incline, so we'll use some pillows for that point. So first I'm going to inspect, and we've got her lying down. I'm going to inspect for pulsations, lifts, and heaves if they're noticed when I palpate. So I'm going to do all 5 of those spots. I'm going to palpate with the pads of my fingers for each location. So I'm going to check the aortic, the pulmonic. Normally we would do this without a shirt on, but for modesty, we're going to have a thin, lightweight shirt. The Erb's point, the tricuspid, and the mitral. So I'm feeling with the pads of my finger to make sure that they don't lift. If they lift, then that can indicate enlargement of the heart. Next, I'm going to check for thrills, and that's going to be with the ball of my hand, and I'm going to go over those precordium areas again and feel if I feel any vibrations or thrills. Ideally, we don't want to feel lifts or thrills. So again, I'm going to use the palm of my hand, and I did perform hand hygiene when introducing myself to Autumn in case I didn't simulate that and say aortic, pulmonic, ribs point. Tricuspid. And mitral. So note the thrills or palpations are noted. If I did feel a thrill or palpation, then I would be looking for a murmur, and I would want to look more in that section, precordial area, if I felt a vibration. The next part is going to be for palpation of the apical impulse. And I'm going to have Autumn lay down, so keep laying down for that. And this is a point of maximum impulse. So when the patient is supine, I'm going to palpate the fifth intercostal space, mid-clavicular line, and I'm going to feel for pulsation. The apical pulse should be less than 2.5 centimeters wide. It should be brisk and about less than 2/3 systole. If the apical pulse is laterally displaced, it could be from pregnancy, it could be from heart enlargement. If the apical pulse is hyperkinetic, it could be somebody young at age, who's an athlete, who recently exercised, hyperthyroidism, or anemia. Or it could also be aortic stenosis or aortic regurgitation. So next I'm going to listen. I'm going to auscultate all 5 points, and I'm going to start with the diaphragm, and I'm going to have Autumn just keep laying supine here for me. Autumn, I'm just going to sit next to you, and I'm going to listen to all 5 of those areas. All right, now I'm going to do the same thing. I'm just going to listen to the bell, the smaller side of the stethoscope. So aortic, pulmonic, okay, good. So now I'm going to have you, Autumn, lay on your left side. I'm going to have you put your knees up just a little bit. Nope, not like that.
Like that?
I'm going to have you back up just a little bit so that we can see the computer's.
Right there?
Lay your head down here. Okay.
You want my arms anywhere?
Hang on just a second. I'll have you put your arm here so that we can see, and lean back a little bit, because I'm going to listen to all 5 points again.
Okay.
First with the diaphragm of the stethoscope. You relax for me. Just breathe normal. I'm going to listen again with the bell. Good. Okay, now Autumn, I'm gonna have you sit up. Scoot over into the camera frame. And I'm gonna have you lean slightly forward.
My hair is a mess.
That's okay. I'm just gonna sit behind, scoot over a little so we can both be on the camera. So I'm gonna listen. I'm gonna have you hold and then exhale for me. And I'm gonna listen to all 5 of those areas. So I'm gonna listen to you as you hold it and then breathe out. I'm gonna listen with the diaphragm and then I'm gonna listen with the bell again. So hold, breathe. Okay, now we're gonna switch to the bell. And same thing, hold and then exhale for me. So heart sounds heard S1 and S2, no S3, no S4, or no murmurs, no rubs or gallops. Next we're going to listen to the arteries for any bruits. So again, I'm going to have you lay back down, Autumn, for me. So let's get you situated, lay on your back supine. I'm going to scoot your head in there again.
Like that?
Yeah. So I want to listen to you again. Oh, I have to have you about 30 degrees. So since we don't have a bed that inclines, we'll use this as our incline. Okay, lay back down for me. Okay, I still see you in the camera. Okay.
Like this.
Okay, so now I'm going to use the bell. So the small side of my stethoscope. Put your feet on the bed, please. Lay flat. And I'm going to listen to your carotid arteries. Maybe I need you a little flatter. Try that. Let's sit up real quick. There we go, try that. Okay, now I'm going to listen to the carotid artery. So for this, I'm going to have you just keep your face looking forward, just relax. And then I'm going to use the bell, and I'm going to have you hold your breath. Oh, it's stuck in my hair. And I'm going to listen to each side. No, don't do that. Now breathe. Hold in and then breathe. Take a breath in. Hold your breath. Okay, you can let it out. Same thing, I'm going to have you take a breath in. Hold it.
It tickles a little bit.
So, no, No bruits were heard. So now I'm going to move to auscultate to your abdominal artery. So that's going to be your belly down here. I'm going to listen for aortic bruit. So this is going to be between the bell, with the bell. And this is going to be between the xiphoid process and the umbilicus line. And no bruits were noted. Next is going to be the renal arteries, and this is going to be slightly below the abdominal aorta and laterally to the midline. So I'm going to listen to both sides. And I'm also going to listen with the bell. Okay, so for the renal arteries, there's no bruits heard. And next I'm going to have you switch up just a little bit. This would be your legs. So we would listen for the iliac arteries. Sorry, that's the femoral arteries that we would be listening to. For the legs, we would listen, it would be between the superior iliac spine and the pubic symphysis in the groin region, and we would listen to that bilaterally, and no bruits would be heard then. I'm going to go back to the iliac arteries because we missed that. This is just below the belly button, and I'm going to listen to that each side. So kind of lower than the renal.
Belly button.
So feel your belly button.
My belly button's right here.
All right, so Autumn, that concludes our cardiovascular exam. Do you have any questions for me? All right, I want to thank you for your time and appreciate you helping me out.